My cancer journey has brought many new people into my world. And every time I meet someone, I learn something new. Today, I'm in Huntington Beach to meet with Natalie. She taught me that you truly have the power to frame your own experiences and approach life's challenges in a positive way. Natalie, it's so nice of you to let us come in here today. You are a mom of 2 children. You are a yoga instructor. You're also a cancer survivor. Being a yoga instructor, I would assume that you've probably been proactive about your health?
Definitely. You know, I practice yoga 4 times a week or so, focus on a lot of organic foods and things like that too.
So living this healthy lifestyle, yoga instructor, and you discovered it yourself, right? I always hear from women that when you feel it, you know something's not right.
Right. I literally felt something wasn't right. And I started doing my self checks, and I did feel some type of a lump. And I ended up going to my OBGYN. I figured it was just me.
It's probably nothing,
being ridiculous, you know. But the OBGYN was like, you know, let's send you for the mammogram and just see. So a few weeks later, I went in for that. I ended up having a biopsy. And then maybe a week or 2 later, my husband, Matt, went with me to go find out the results. The radiologist came in. She got right to it. I was diagnosed with invasive ductal carcinoma, and I was estrogen positive. I lost it. I looked at Matt, and he was, you know, welling up and everything. And then I thought about the kids. And that is where, you know, you just completely lose everything. When you hear the word you have cancer, you have no idea outside of that what that means.
Yeah.
And in that moment when everything is so chaotic and so impossible to control, the only thing that I found that I could control was my breath. I could control the intention that I set. Even though it was unknown, I could approach what was coming next with an idea of it being a healing journey in lieu of a battle.
That's such an interesting concept, you know, because everybody looks at it as battling this thing that might kill you. And flipping that narrative and taking it to a healing journey.
You know, and when we talked to the kids about everything, we wanted to make sure that they realized we were going to try to approach this in a positive way, in that you find compassion for others through suffering, observing suffering, and finding the joy and the beauty in that moment.
That's so important to, you know, I mean, because that's, I think, what women struggle with the most, how they're gonna treat this with their family. And then the second thing, of course, is how are you gonna treat the cancer?
Right, so I had 6 rounds of strong chemotherapy. And, you know, there was a lot of information coming at me, but during that time, they let me know about the risks of infection.
So did your doctors speak to you about what their course of action?
They did. They told me that there was a medication, Neulasta, that they would be giving to me to help protect me against the risk of infection.
Indication: Neulasta, PEGFILGRASTIM, is a prescription medicine used to help reduce the chance of infection due to a low white blood cell count in people with certain types of cancer, non-myeloid, who receive anti-cancer medicines, chemotherapy, that can cause fever and low white blood cell count. Important safety information. Do not take Neulasta if you have had a serious allergic reaction to PEGFILGRASTIM or filgrastim.
Please see additional important safety information at the end of this video.
I had my chemotherapy on Fridays because I wanted to keep teaching yoga, and my clinic was closed over the weekend. So they let me know that I had the option to get the Neulasta Onpro.
So I got diagnosed a year before you. So I didn't get the advantage of having the Onpro. I had to go back for the shot each time. I want to know what it's like, because I imagine a lot of people might say, wait a minute, what is that?
So on the same day as I received strong chemotherapy, my nurse would apply it to my arm, and then it delivers my Neulasta the next day automatically.
How?
It starts to beep, and then it starts to do its thing. And then when it was done, I just took it off and disposed of it, and it was done.
And that was it?
That was it. I was able to be with my family.
You could just like be as normal as you could.
Exactly, and you know, that's the thing that we lose when we are diagnosed with cancer, is that sense of normalcy. So to be able to keep being mom and wife, whatever, just being a person, that in itself was the gift.
Now that you're on the other side,
Yes.
do you find that you just have these moments of intense appreciation?
I do. And you know, nobody wants to have cancer, but having that placed in front of you makes you change the way you approach everything. We don't control everything, but we do have control over the words that we choose, the energy that we give to things. And you know, even in the midst of the worst days, there are beautiful moments. And I think that if we set an intention, we can change the shape of our experience and make it joy-filled, even if it is challenging.
Important safety information. Before you receive Neulasta, tell your healthcare provider about all of your healthcare conditions, including if you have a sickle cell disorder, have had severe skin reaction to acrylic adhesive, are allergic to latex. The needle cap on the pre-filled syringe contains dry natural rubber derived from latex. Kidney problems, are pregnant or plan to become pregnant. It is not known if Neulasta may harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Neulasta passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible serious side effects of Neulasta? Spleen rupture. Your spleen may become enlarged and can rupture while taking Neulasta. A ruptured spleen can cause death. Call your healthcare provider right away if you have pain in the left upper stomach area or left shoulder tip area. A serious lung problem called acute respiratory distress syndrome, ARDS. Call your healthcare provider or get emergency medical help right away if you have shortness of breath with or without a fever, trouble breathing, or a fast rate of breathing. Serious allergic reactions. Neulasta can cause serious allergic reactions. These reactions can cause a rash over your whole body, shortness of breath, wheezing, dizziness, swelling around your mouth or eyes, fast heart rate, and sweating. If you have an allergic reaction during the delivery of Neulasta, remove the on-body injector for Neulasta by grabbing the edge of the adhesive pad and peeling off the on-body injector. Get emergency medical help right away. Sickle cell crisis. You may have a serious sickle cell crisis, which could lead to death if you have a sickle cell disorder and receive Neulasta. Kidney injury, glomerulonephritis. Neulasta can cause kidney injury. Call your healthcare provider right away if you develop any of the following symptoms: swelling of your face or ankles, blood in your urine or dark-colored urine, or you urinate less than usual. Increased white blood cell count, leukocytosis. Your healthcare provider will check your blood during treatment with Neulasta. Capillary leak syndrome. Neulasta can cause fluid to leak from blood vessels into your body's tissues. This condition is called capillary leak syndrome, CLS. CLS can quickly cause you to have symptoms that may become life-threatening. Get emergency medical help right away if you develop any of the following symptoms: swelling or puffiness and are urinating less than usual, trouble breathing, swelling of your stomach area, abdomen, and feeling of fullness, dizziness or feeling faint, a general feeling of tiredness, inflammation of the aorta, aortitis. Inflammation of the aorta, the large blood vessel which transports blood from the heart to the body, has been reported in patients who received Neulasta. Symptoms may include fever, abdominal pain, feeling tired, and back pain. Call your healthcare provider if you experience these symptoms. The most common side effect of Neulasta is pain in your bones and in your arms and legs. These are not all the possible side effects of Neulasta. Call your healthcare provider for medical advice about side effects. You may report negative side effects to the FDA at 1-800-FDA-1088. Please see Neulasta patient information.
Thank you for watching.